Worldwide, coronavirus cases have climbed to an all-time high of more than 330,000 per day. Europe is facing unprecedented cases with spikes in Germany, the Czech Republic, Italy, and Poland. We look at conditions on the continent, in the United Kingdom, as well as Latin America. Nick Schifrin is back to begin our worldwide wrap.
For months, Europe had COVID in check. Today, the continent faces a reckoning.
The second wave in Europe is major. It's a huge wave.
Dr. Karl Lauterbach is one of Germany's leading epidemiologists and a member of the German Bundestag. He says the continent is especially vulnerable because it has an older population.
That is the reason why I think that the second wave is a big problem for us in Europe, in all big cities in Europe.
This is Lucy Hoff in Brussels. Tough new measures in Belgium, where a curfew has just been imposed from midnight to 5 a.m. and people must work from home. Bars and restaurants have now been closed nationwide for a month. It comes as the number of people being admitted to intensive care is doubling every 12 days.
Health officials are warning that if the current rate of hospital admission continues, Belgium's 2,000 intensive care beds could be full by mid-November.
Taking stock with new restrictions now a reality. This brewery in Brussels was hit hard by weeks of closure in the spring, but so far has kept afloat. With Belgium consumed by a second wave of the virus, uncertainty and anxiety have returned.
We're not looking with a lot of excitement, as you can imagine, to a second full lockdown.
France has once again declared a state of emergency with a strict curfew imposed in 9 cities between 9 p.m. and 6 a.m. In Paris, the total saturation of the region's hospital beds could come by the end of next week. The curfew is stricter than some had anticipated.
It's a good solution to end group meetings and close contact. If it avoids stopping the economy and life in general, why not?
It means we just go to work and go home, so we have less of a social life, and it feels complicated.
In the Spanish capital, Madrid, millions are living under partial lockdown as case numbers surge. Non-essential travel is banned, restaurants are under curfew and limited to 50% capacity. There's been local opposition to the measures, but the Spanish government is standing firm. In Germany, case numbers are higher than ever and hit 6,500 today. But varying local restrictions in its 16 states are causing confusion. The German government has warned citizens if they don't follow the rules, the restrictions will increase.
If we do not see markedly different behavior, we will ultimately have to crack down on the restaurants, the bars, the pubs.
This is Malcolm Brabant in England, where COVID has exposed the country's north-south divide. The northwest has the highest rate of infections. The government wanted to apply the top tier of new restrictions, limiting socialising and forcing hundreds of pubs to shut. But Manchester's Mayor, Andy Burnham, refuses to comply.
They are asking us to gamble our residents' jobs, homes and businesses and a large chunk of our economy on a strategy that their own experts tell them might not work.
That puts him on collision course with the Prime Minister Boris Johnson, who believes regional lockdowns are Britain's best medicine.
If agreement cannot be reached, I will need to intervene in order to protect Manchester's hospitals and save the lives of Manchester's residents.
Breaking COVID laws can have dire consequences. Worried about going bust, owner Nick Whitcomb refused to close his northern gym and tasted draconian punishment.
So they've issued the fine. First one's 1,000. They can come back in 3 hours, issue 2,000, 3 hours after that, 4,000.
With infections reaching up to 28,000 a day, Sir Keir Starmer, now leading the opposition Labour Party, demanded a new national lockdown lasting 2 to 3 weeks.
The government has not got a credible plan to slow infections.
From midnight tonight, London will be subject to a second-level lockdown that'll bar different families from socialising, and there's a 10 p.m. curfew. 60 miles south at the Station Hotel in Brighton, where safety measures are rigorously maintained, Steve Platel fears another lockdown. The last one cost him thousands in lost revenue, and he had to lay off half his staff.
Well, I don't have any confidence at the moment. We're just waiting to see what the next disaster is, really. It doesn't seem to be getting any better.
With the economy tanking, opinion polls consistently show that the British public is losing faith in Boris Johnson. And today, the biggest-selling Conservative newspaper turned on him in an editorial, saying that his incoherent policies had turned a crisis into an epidemic of madness.
Halfway across the world, Latin Americans face a COVID crisis. This is Mari Trini Mena in Caracas. 61-year-old street vendor Joel Gil should be at home because of Venezuela's quarantine. But he says if he doesn't work, he will starve.
I need to work. I always try to earn something so I can pay for my food.
For millions of Latin Americans, lockdown orders mean no income. Many of them depend on community kitchens that provide one meal, sometimes the only meal a day. Governments throughout Latin America face a double challenge, limiting the spread of the virus and its economic devastation.
5 of the 10 countries in the world with the highest rates of COVID-19 infection and the most deaths from it are located in Latin America.
Epidemiologist Alejandro Rizquez.
The measures taken in each country have had completely different repercussions. There are countries where the measures are really strict, but in others, they are much more relaxed.
Brazil, with the worst infection and death rates, has had no lockdown, and its president, throughout, has made light of the virus, even when he got sick. Mexico's government played down the pandemic too early on. Peru implemented a strict lockdown, but many people did not comply. Like the rest of the world, Latin America is waiting for a vaccine. Meanwhile, COVID survivors in Caracas are donating plasma for experimental treatment.
I was lucky to have mild symptoms, and now I'm lucky to help others to fight the disease.
But it will take more than luck to get us through this global crisis. Scientists warn cases could increase 5-fold as the weather gets colder and people gather inside.
In the winter time, we will have a major challenge, and we are currently seeing the beginning of that.
And that means the world faces a difficult winter after what has already been a difficult, long year. With Lucy Hoff, Malcolm Brabant, and Mary Trini Mena, I'm Nick Schifrin for the PBS NewsHour.